And tonight, more than 1,600 Kentuckians will spend the night in a hospital so sick with COVID they require round-the-clock medical treatment. It comes as more hospitals like one in Elizabethtown are running out of room to care for the patients. Here's a look at hospitalization rates. You can see on the right of your screen the number of COVID patients has skyrocketed in just a few short weeks. We haven't seen rates like this high since last winter. The rates are very concerning since there are many reasons people need hospital care. WHS 11's Grace McKenna takes us inside one Elizabethtown morgue, preparing to help Baptist Health Hardin with its own surge.
Here in Hardin County, just 1 or 2 deaths makes the difference between having space and an overcrowded morgue, and that's why the coroner's office is preparing now. The Hardin County coroner's 8-person morgue is full.
We were full. We were at max capacity. We couldn't take any more.
Deputy Coroner Shayna Norton is used to filling up, saying 1 or 2 deaths make a big difference to capacity. Now a new challenge, Norton is on standby to help Baptist Health Hardin with a refrigerated trailer in case the hospital's morgue fills too.
Whether it happens or it doesn't happen, I think being prepared for it and having the avenues and items that we will need if we got to that point is the best thing. And that's what the hospital's doing. Officials
at Baptist are preparing for dire circumstances as COVID cases surge. During the governor's Team Kentucky update Thursday, they warned COVID patients occupy more than 1/3 of hospital beds.
We're asking, in fact, we're pleading with every Kentuckian, please get vaccinated.
Doctors also said they're using ventilators and oxygen at alarming rates. In the ICU, 18 out of 20 beds are full. The crowding problem is different at the coroner's office.
We're full. We are full, but we're full because of unrelated COVID things.
Norton says overdose deaths are to blame. The coroner is also holding several spaces for funeral homes. In a county this size, deaths at Baptist, COVID-related or not, bring all hands on board.
It's kind of like a trickle effect. If the hospital has a mass death, these deceased have to go somewhere.
A sobering reality health officials say is straining the health system, and that could mean a return to the early days of the pandemic for Norton.
We've actually not even seen any cases that are COVID related. Probably in the last 3-4 months.
The coroner's office itself here in Hardin County has actually only had a small handful of COVID-related cases since the pandemic began. In Hardin County, for WHAS 11 News, I'm Grace McKenna.